Okay, so we can begin now very quickly. Last lecture, we look at anti-folate synthesis, and then we discuss sulfonamide and also trimethoprim. We also discuss the combination of these two antibiotics to form what we call cotrimoxazole. And then we saw that their recipe, their mechanism of action through the inhibition of folic acid synthesis, which is needed in purine and pyrimidine synthesis, which is our DNA. We saw how the sulfonamide alone inhibits the folate acid synthesis, while trimethoprim at the later part of the pathway synthesize or inhibits the hydrofolic acid reductase, and thereby there is no production of tetrahydrofolic acid, which ultimately leads to purine or pyrimidine. So when this happens, we discover that the organism growth will be inhibited. For this reason, sulfonamide, trimethoprim are bacteriostatic antibiotic. So their combination produce a very serious synergetic effect. So that's what that's the mechanism of action. Today we'll look quickly to the nucleic acid synthesis inhibitors, and we will be discussing quinolone and then fluoroquinolone. We are going to look at this antimicrobial agent that have a quinolone structure, and then we'll be looking at nalidixic acid as a prototype of quinolone with quinolone structure. This drug, nalidixic acid, was introduced in the mid-1960s with other newer drug, which is the fluorinated compound, and also available. We have a typical example is our ciprofloxacin. Of course, we will look at various classification of quinolone. As student, as a practice, as a future pharmacist, medical laboratory scientist, Bachelor of Dental Surgery, we want you to look at the classification. We have two classifications, the quinolone and also fluoroquinolones. A good example of a quinolone that we get ourselves familiar with, which is very relevant in clinical uses, is nalidixic acid and also papimedic acid. Also the fluoroquinolone. Of course, the nalidixic acid and the papimedic acid, they are of a first generation quinolone, while the fluoroquinolone, we have second generation, third generation, and also the fourth generation. The second generation quinolone includes ciprofloxacin, ofloxacin, non-fluoxacin, lumefloxacin, enosacin, and fluoroxacin. These are the second generation quinolone, which is known as a fluoroquinolone, because there is an attachment of a fluorine compound. While the third generation quinolone, which is fluoroquinolone, are levofloxacin, gatifloxacin, sparfloxacin. They are all third generation quinolone. Of course, I've said they are fluoroquinolone because their spectrum of activity was actually enhanced by the addition of fluorine. Then the fourth generation fluoroquinolone, trifloxacin, mosifloxacin, and gemifloxacin. So these are the classification: first generation, second generation, third generation, and the fourth generation. Of course, you will discover later that as the generation progresses, the antimicrobial activity of this antibiotic keep on improving in terms of their effectiveness, toxicity, and the pharmacokinetic property. So now let's begin with nalidixic acid. Nalidixic acid is a bactericidal. With the bactericidal, we will see that the reason for that when we look at the mechanisms of action. It's a bactericidal against various gram-negative organisms. And gram-negative organisms like Escherichia coli, Shigella, Enterobacter, Proteus, Klebsiella, they are all Enterobacteriaceae. They are intestinal bacteria, even though they could be serve as a normal flora of intestine, but when they find themselves in another part of the body, they can exhibit their virulency, that is the pathogenicity. The mechanism of action of nalidixic acid is inhibition of DNA garage, which is the same thing as DNA topoisomerase 2. This enzyme involved in the unwind of super-cord strand of the DNA strand. And once this enzyme is inhibited, fragmented DNA will be produced, which automatically will lead to the death of the microorganism. So this is the mechanism of action by which this antibiotic exhibits its action. Let me see whether I can see some few structure to show you that we, yes, this is the supercore DNA. And this supercore DNA has to be unwound. It has to be separated. And then the enzyme responsible for the unwinds of this, if you still remember your molecular biology, that is the DNA replication. You will remember some few enzymes involve helicase, topoisomerase, which involve in the unwind of the supercore DNA. And it is the enzyme that is actually responsible for this being inhibited. Just look at the fluoroquinolone because they have virtually the same. This is the DNA garage. It interferes with the positive supercoiling of the thing. While the topoisomerase 4, when it is inhibited, the separation of the daughter cells will be inhibited also. Therefore, multiplication is being arrested. So we could make use of this enzyme, whether the DNA garase or topoisomerase, so that once this supercalling DNA is unable to unwind, then there are going to be damage to the DNA, and then that's actually going to be degraded by what we call nuclease, and then the bacteria will automatically die. And that is why it produces bactericidal effect. I believe that is well understood. Okay, so this so we are still talking about nalidixic acid, but I need to take you down to that because both the fluoroquinolone, that is ciprofloxacin, or any of these generation still make use of the same mechanism of action. Let's look at the pharmacokinetic of nalidixic acid. Pharmacokinetic of nalidixic acid. Nalidixic acid is well absorbed orally, meaning that it can be given orally, can use enteric enteral route of drug administration for the administration of it. However, the plasma concentration of the free drug is inadequate to produce a systemic effect because the drug undergo rapid excretion. It also means that you have high concentration of the drug in the urine. Of course, that is why it is very, very useful as to be used in urinary tract infection because the drug get easily excreted in the urine, but the oral administration, it is okay and it is well absorbed. Adverse effects. The adverse effects are uncommon, very uncommon, but however, we have seen some few adverse effects. Adverse effects like hemolytic anemia, but it's particularly common in patients who have glucose phosphate dehydrogenase deficiency. We have noticed that polymorphism actually occur as a result of this gene that make the individual to have deficiency of glucose phosphate dehydrogenase. Also, we have seen hemolytic anemia. Also, people who have taken citric acid as report allergic reaction. It also causes central nervous system effect, such as headache, magias, drowsiness, also visual disturbance, maybe encounter. Several of these CNS effects, headache, malaria, drowsiness, and also visual disturbance may be encounters sometimes. These are the few adverse effects that is associated with nalidixic acid. What are the clinical uses? Number one, it's used in urinary tract infection. Used in urinary tract infection. Of course, nalidixic acid is regarded as urinary antiseptics. Of course, I've told you the excretion, the concentration is so high in the urine because of the polarity of the drug. So in this case, it is urinary antiseptic is used in an uncomplicated UTI that caused by Escherichia coli, Shigella, and Brutus. So it's very effective. The other uses of nalidixic acid is in diarrhea. In diarrhea. So nalidixic acid is used in the treatment of diarrhea due to Proteus mirabilis, Escherichia coli, Shigella dysentery, who are involved in diarrhea. And also the possible doses of this is 0.5 to 1 gram 3 times a day. Okay, and several of these available drug, Gramonec, Eurodisc, which come in 500 milligram or to 0.3 milligram in liquid form. Yes. So what are the limitations of this nalidixic acid, that is quinolone? The first member of nalidixic acid, as I said, was introduced in the mid-60s. Its usefulness is limited to urinary tract and GIT infection, because it's majorly aiming at Escherichia coli, Proteus, Klebsiella, all those enterobacteriaceae, okay, because of the low potency. And then although it's not too available in the blood, the tissue, it has a restricted spectrum. And then the level of bacterial resistance is so high. So these are the limitations of this drug. So they use in urinary tract infection and gastrointestinal tract infection, and also the potency is low because of its rapid excretion. So for this reason, this quinolone has to be improved upon, and that's what gave back to fluoroquinolone. And let's look at the fluoroquinolone. I say we have several of them. We have the second generation, third generation, the fourth generation. The fluoronated quinolone was synthesized, and then as a result of the limitation of nalidixic acid. And then the fluoroquinolone has many advantages over quinolone. Number one advantage, it has a widespread of activity, meaning that it is more of a broad spectrum antibiotic. It also has fewer side effects compared to nalidixic acid. They also have lesser chances of resistance compared to also nalidixic acid, that is quinolone. And also in contrast to the nalidixic acid or quinolone, it attains therapeutic blood level. It's not easily excreted like nalidixic acid, and it has a better tissue penetration. These are the structure of the chemistry, the structure of fluoroquinolone. That's what gave it its name, attachment of this fluorine compared to nalidixic acid. These are the structure, and we have a typical example. This is actually the basic structure of quinolone with two benzene ring attached with hydroxyl group and oxygen group. So we have this is a structure of non-fluoxacin. This is a structure of ciprofloxacin, and this is the structure of mosifloxacin and also levofloxacin. Of course, they are named, most of them, as sacin. That's how you will get to know about fluoroquinolone. So get yourself familiar with these four: non-fluoxacin, ciprofloxacin, mosifloxacin, and then levofloxacin. Yes, as Rob said, as a way of introduction, a breakthrough was achieved in the early 1980s by fluorination of the quinolone structure at the position 6, and introduction of a papyracin substitute at position 7 result in this derivative. That is how it was gotten. At this position 6, there is attachment of fluorine, and at position 7, there is a papyramine that was attached that increases antimicrobial activity and make it better. It is called fluoroquinolone with high potency, expanded spectrum, low development to resistance, better tissue penetration, and good tolerability. So this is far, far better, more potent, more resilience in terms of bacteria developing resistance when we compare it to nalidixic acid. Okay. Yeah, so we have so many generations of fluoroquinolone. The first generation agent norfloxacin, which sometimes we consider it as second generation if we want to flow it off from the quinolone nalidixic acid. So we have norfloxacin, ciprofloxacin, paclufloxacin, or floxacin. And then the second generation includes levofloxacin, lomefloxacin, sparfloxacin, atifloxacin, mosifloxacin, and genifloxacin. They are of second generation, which is we have for that third generation and also the fourth generation, but this is very, very common and commonly used in today for the treatment of microbial infection. Yes, the mechanism of action, as I've highly discussed with that of nalidixic acid, is similar. They are bactericidal, because they actually completely destroy the DNA. They probably stop the DNA replication. Automatically, the organism will lack the gene, continue the life. So they inhibit the bacterial enzyme, DNA agarase, and topoisomerase 4, which are required for DNA replication and transcription, as well as exhibit their mechanism of action. Of course, I also need to come and show you again. So these are when the DNA agarase and topoisomerase 4 is inhibited, it will not allow the supercore DNA to unwind, therefore produce a DNA fragment, and automatically they are going to be damaged to the DNA, and then the bacteria will actually die. So, so that is the mechanism of action. They actually inhibit these two enzymes, therefore stop replication and also transcription before translation. So by they inhibit this enzyme, quinolone inhibit DNA replication. So fluoroquinolone also inhibit topoisomerase 2 and block the separation of the daughter cells. And then bacteria with damaged DNA are formed, which are degraded by nuclease enzyme. Thus, fluoroquinolone are bactericidal. Bactericidal, the DNA, or through the separation of the daughter cell, is as a result of the presence of topoisomerase 4. And then when this enzyme is inhibited, the daughter cell will not be able to separate. And once it's not separated, the DNA will be damaged, and of course, the bacteria will automatically die. This is the mechanism of action, very interesting. So of course, I say that's why it's called bactericidal. So what are does this bacteria also develop resistance to this drug? The answer is yes. So resistance to fluoroquinolone could occur due to number one, due to mutation in the target enzyme, that the drug lost affinity for the target enzymes. The target enzyme is DNA garase and also topoisomerase, DNA topoisomerase 4, which actually help for the daughter test to separate. If the drug, if the organism develop resistance gene that produce an enzyme that lost affinity for this hence for this drug, then certainly it will not be able to kill the bacteria, and also through a change in permeability of the organism to the drug. The cell membrane of the drug may not allow the drug to penetrate, then of course it will not be work. And number three, production of DNA garage by some protein plasmid mediated resistance. Just as we have them, we are early to you were talking about sulfonamide, and we talk about para-aminobenzoic acid, that the organism can undergo some kind of genetic mutation that make the organism to overproduce para-aminobenzoic acid, and therefore the presence of sulfonamide will not be necessary, will not produce any effect. So also there could be overproduction of this enzyme, DNA garase, by some mutation, some genetic mutations, maybe like a plasmid, and then this. So this is the way by which this organism show resistance. Are we still follow? Yes, I know you are following. Yeah. So let's look at the clinical uses of quinolone. It's just like quinolone, the nalidic acid. It is very useful in urinary tract infection. Very useful in urinary tract infection. Very effective in UTI that are caused by multi-drug bacteria, especially when we employ norfloxacin, generally used. It comes in 400 milligram BD for 5 to 10 days, okay? And then it's also very useful in typhoid fever. Especially ciprofloxacin is a drug of choice. 500 milligram BDS for 10 days. It is also, you are sure that you have a complete eradication of this organism. I also find its usefulness in diarrhea due to Shigella, Salmonella, Escherichia coli, Campylobacter. They respond so well to this drug. The fourth uses is in gonorrhea. Just a single dose of 5 milligram of ciprofloxacin is highly curative but resistant in many countries. As is now, it's no longer the first line of treatment of gonorrhea because the Diplococcus have developed a lot of resistance to the organism. You can use any of those four ways by which drug developing resistance. It is also very useful in chancro. Chancro, and it's an alternative to cotrimoxazole in the treatment of chancro. Ciprofloxacin is useful for 3 days. These people are so responsive and then effective. And then another area that is useful is respiratory tract infection. Respiratory tract infection due to Haemophilus influenza, Legionella, and Mycoplasmon can be treated with fluoroquinolone. Gamifloxacin, mosifloxacin, gatifloxacin, and levofloxacin are called respiratory fluoroquinolone as they are effective against most respiratory pathogens, organisms which including gram-positive bacteria such as Legionella, Plasmodium, and also Mycoplasmodium. Fluoroquinolone is also used in bone, joint, and soft tissue, and abdominal infection. Osteomyelitis, joint infection that require a prolonged treatment is also very useful. And also soft tissue infection due to sensitive bacteria can be treated with fluoroquinolone. It's highly effective antibacterial. It has also found its usefulness in tuberculosis, especially ciprofloxacin is one of the drugs in multi-drug regimen used for resistant tuberculosis. It's also useful in atypical mycobacterial infection. Also, it's also useful in bacterial prostatitis and cybersitis. Fluoroquinolone are useful in chlamydia, urethritis, saprophysitis, also respond to ciprofloxacin. Or ciprofloxacin can also be used as an alternative to tetracycline. Also, to also appear in ear infection as an ear drop. This also may be used topically in the treatment of ear infection. Also, in arthritis, ciprofloxacin has also found its usefulness. Is the drug of choice for arthritis. It's also useful for prophylaxis. Also, in neutropenic patients, fluoroquinolone may be used for prophylaxis infection in neutropenic patient, gram-positive, gram-negative sepsemia. It has also found itself may be combined with other one, also meningococcus carrier state, has found itself in the usefulness of it. Yeah, so these are the numerous uses of fluoroquinolone, a very useful drug. And I'm sure in your practice, you will encounter it a lot. And because it's a bactericide, it's have a very rapid of action and kill the microorganism so fast because of its effect in topoisomerase 5 and DNA carriers that actually damage the DNA and also prevent the daughter tail from being separate. Contraindication. Number one, fluoroquinolone are contraindicated in pregnancy, just as most of antibiotics contraindicated in pregnancy because of their possible teratogenic effect. And also number two is to be avoided in boys and girls less than 18 years of age because fluoroquinolone damage the growing cartilage and cause arthropathy. So that is very, very significant. However, since the effect is reversible, fluoroquinolone are being used in some selective infection in children. Okay, so just we have practically said that you use the drug sometime when the advantage or to weigh the disadvantage. And since this effect is reversible, and if the infection needs, especially if the organism show a high level of sensitivity to fluoroquinolone, then that can go ahead and use it. Okay, it's also to be avoided in patients with prolonged QT interval. That is especially those receiving other drugs that prolong the QT interval, especially drugs like mefloquine, erythromycin, and class 1 and class 2 anti-aremetic drug. Also, should also be avoided toxicity due to taufelin and other epileptogenic drugs be precipitate fluoroquinolone due to microsomal enzyme inhibition. Of course, I also refer you back to our enzyme inhibition, enzyme induction. When you use this drug, we use this drug together with fluoroquinolone. This drug can inhibit cytochromic P450, whether 2D6, whether 2D3, and also the fluoroquinolone cannot be potentiated because those enzymes, the drug will not be metabolized. So that must pay a special attention to. It should also be avoided to use together with calcium, iron, and other divalent cations should be avoided as they reduce the absorption of fluoroquinolone, thereby reducing the bioavailability of fluoroquinolone. So it should not be used alongside with calcium, iron, and other cation preparation because they reduce the absorption. Those adjustments also must be done in renal failure, except for moxifloxacin, which is have not shown any serious renal irritation. So if the patient has a renal issue, so the dose has to be adjusted. We have to do what we call therapeutic drug monitoring, and then the dose is adjusted. I hope we are still following. Let's quickly look at the adverse effect or adverse reaction, say, result of the use of fluoroquinolone. As you said, they are well tolerated. However, people who have used fluoroquinolone has complained of nausea, vomiting, abdominal discomfort, diarrhea, and skin rashes may be seen in some rare cases. So thank you. So that would be what I think I want you to know about quinolone and fluoroquinolone. I think we can leave it at this level so that in our next lecture, we begin with other class of antibiotic. Thank you very much for your time.